We are going to have Gary Fingerman come on. He is the lab owner of Elegant Dental Lab in New York, and excited to have him on. So looking forward to speaking with him for a few minutes today.
How are you?
How
How
you
you
doing,
been?
buddy?
Very good.
So I called. This is how I met Gary just a few weeks ago. We were chit chatting on social media, and I said, "Hey man, why don't we get on a call?" So I got on a call. He's walking the streets of New York when they had the storm just a few weeks ago, and it's interesting how we meet. He's walking in the snow, and I'm sitting in the
It
sun.
was a crazy weather.
So
Crazy.
yeah, but we had a great conversation. Look, our goals are the same. It's interesting as I talk more and more with people in the industry. Everybody's, I mean, for the most part, I've met some amazing people, and Gary's one of them in a sense that what he wants to do is just, help the profession. Granted, he has a business. Everybody, has an everyday process, but, the depth of what he's trying to do is be economical, just like Kevin was earlier, and try to help the doctor, run their everyday. Gary, tell us a little bit about yourself, your lab, why you became a lab owner. Let us learn a little bit more about
That's
you.
a good question. Okay, so my name is Gary Fingerman, and I own Elegant Lab, and I'm technician for about 30 years. I'm person technician by training, and over the years we evolve new technology, digitally. I'm doing digital for many many years from the day one when all the technology became, for people get started with everything of filling, scanning, digital crown, digital, for patients to know it's easier, no impression. So I love this business. I like to help other labs, doctors to get to know this, technology, to get to know the industry, and I'm trying my best to run my business. I have about 35 employees, dental technicians, not easy, and I'm here to talk about, everything that we can help each other.
Yeah, and you have a busy lab. So tell me a little bit about so you've been a lab technician, and one day you're probably, after a couple of years of being a lab tech, you're like, hey, I want to have my own lab. So I'm
Yes.
assuming that's kind of how it evolved. When did Elegant Dental Lab open? Um,
I created Elegant Lab, I think it was 2010,
2010.
around 10 years, maybe 11 years.
And obviously you're servicing the nationwide and the East Coast as well.
Yes.
We wanted to talk a little bit about a couple of things. Let me just fill you in a little bit on this, and then we'll get into some digital technology and what your
Great.
lab can provide. But one of the discussions I've had with Gary, and we're still in discussions, is through our Love Bites Dental program, we want to provide what's called a Love Bites Smile. And a Love Bites Smile, as you all have heard of this term, Snap-on Smile, is basically synonymous with that. So, look, we, in my practice, we have a lot of surgical cases. We have patients that come in that can't afford a $15,000 or $25,000
Yeah.
treatment, and they, if they need surgical cases, the stay plate is, this floppy thing that
Right.
bounces in your mouth. You can't talk. You're doing, and the patient is kind of going, this is. Do you have a better option?
Not comfortable.
Yeah. So we've been in talks, and we're trying to, acetyl resin is a discussion we're having right now with materials, to be able to create a snap-on smile. But through our Love Bites Dental program, we're trying to create a direct-to-consumer Love Bites Smile, where doctors can get a 8 to 10 to a full arch snap-on, where they can, if they're doing number 4 and number 8, or number 7 and number 10, extract, graft, membrane, implant, and wait for healing and all those things, they have that option to place that. And then obviously it can also be a snap-on as a aesthetic component for a patient that, they hate the dentist, they don't like the needle, they don't want their teeth
Right.
cut, they can't afford it, they're afraid of the dentist. All of these combinations, a snap-on could be a great option for them to
To
have
use, yeah, to
to
have.
use when they want to go into their special events. So let's talk about this. Tell me why digital impressions is taking over the industry today.
There is a few reasons, and the main reason it makes the restoration come back to the patient, to the doctor faster. Doctor scans it, and the laboratory will receive a file within minutes, and we can already start to work on designing, producing, milling instead of waiting for the impression to come. And the main thing is, in the summer it's very hot. In the winter in New York it's very cold. So a lot of materials not really good at sustaining high temperatures, low temperatures. So it's the stores. Digital files, they're not distorting, so we can work and the doctor get back within a few days a finished restoration instead of waiting, sending back and forth. It's a lot of benefits to it. Also, impression material costs money, 20, 15, $30 an impression. Instead of just take a scan and send it to the lab, you save money that way also. It's economically better, and time-wise, doctors saving time, which just makes a lot of sense.
So what products can dentists offer their patients using digital technology?
I would say any product. We can make implants, we can make zirconia crowns, we can make love bites, we can make any restoration that you can do with impression. Most information we can do digital. Um, it's a learning curve. Anybody that takes a good impression, preps well, it's a little bit of a learning curve. It's a little bit different, but once you get to know the technology, how to use it, it works very, very well. So I would really highly recommend, if doctors don't have it yet, they thinking about it. I would really suggest they can try or call your rep to come and do some demonstration, on the patient.
Yeah, I mean, I think digital technology certainly has a big place in our profession today. Um, what are your thoughts? I know you have a lot of technology in your lab. Can you explain a little bit about what technology you have in your lab, Gary?
Yes, absolutely. So mainly we use 3Shape software, which we have like 10 stations, scanning stations, designing station. And I've been using 3Shapes since day one, which we really like. It's a very, productive, very accurate system to use. Also for dentists, for practice, there is another system which we really like, which is iTero, and you can scan, do Invisalign, you can do a lot of products in the office that will help you to speed up and more accurately with the iTero and 3Shape. And this is the two system I think is the best on the market to use.
Yeah, so if there were, maybe three or four top services that your lab provides, what would they be? Gary, what are your thoughts on that?
The services we do a lot of implants digitally. Our clients, we send them scanning flags. Few people, people call it. Some people call it different, scanning flags, scanning jigs. Essentially is the same. It's a digital impression copy. We do a lot of implants digitally, which makes a lot better. We do Emacs, we do zirconia, we do dentures. I mean, anything that you can accurately scan, we can produce. So that's really top products, we can produce in the laboratory.
One of the things I'm a little challenged with this statement that I'm going to make. Doctors have equipment in their offices, and they avoid sending cases to labs because they want to do cases in house. And
Right.
I believe there's certainly, that's a separate discussion. It's a big discussion, but
Yes.
I believe that when it comes to cosmetic dentistry, smile designs, 4 units, are not necessarily smile designs, but anything 8 units or more are more considered smile designs. I'm a strong proponent that those should be sent to a professional lab and made professionally. To be honest, in 20 years of being in private practice, I've seen probably 3 to 5 dentists that
Right.
that really have that skill, fully developed in their place of business, where it's very comparable. And many times, those dentists or general practitioners were, lab technicians, so they had
By
that.
training, they were used to be
Yeah.
right.
I mean, I don't have, like, I talk about the business side of dentistry, right?
Right.
So I have an MBA, but most of us don't have the business side of dentistry. And look, just because you have an MBA doesn't mean you're not going to
Right.
fail. I failed many times, right? But what I'm trying to say is that I don't have any lab background. I'm not a lab technician by trade.
Right.
And so, to hand it off to my RDA or RDA-EF to get them
You don't
trained.
have enough time to do
Well,
this.
the thing is I think the signature of, every practice needs to have something that has value. My practice's name is Irresistible Smiles. That means I can't fail on my cosmetic dentistry, and I can't shortcut that. I'm not offering these at $600-700 a unit. So if you're trying to shortcut the component of providing what the name of your business is, if you're saying things like, I'm a cosmetic dentist, I provide high quality cosmetic dentistry, any kind of those taglines or names that are used in your place of business, unless you're a lab technician or you have your own in-house lab
Right.
that can help you with this, I think these are cases that should be sent out. Um, what are your thoughts on that? I mean, tell me. I know you work with doctors
Listen,
every day. So.
absolutely. You're absolutely right. I have a few clients, they bought a few systems they can mill in-house. Emax crowns, Serona, does it work? It does work. But when you're looking at a final product, and as a technician, I see that it's not the product that I would like to have it in my mouth. Not the fit, for some, but the finished look. It's not glazed the same. It doesn't have enough the same anatomy. It doesn't have enough of the natural beauty of it. So if it would be me, I would probably, as a doctor, I would send it to the lab. But some doctors obviously like to, save, on the cost of the crown, maybe the time somebody going away, which is, you can do it in an hour, 2 hours, which makes sense. But on an everyday workflow, I would not, do that if I would be a doctor.
And the other component of this, Gary, that I think is important is the redos, right? I mean, you're trying to profit from a specific service. So
Correct.
last thing you want is, you don't want your client doctor or patient doctor relationship to be damaged because you deliver a case, because you try to do some level of speed or shortcutting.
Absolutely.
And then before you know it, the patient comes back and says, I'm not happy with this case. Look, I've done a lot of redo cosmetic cases in my time, and it's unfortunate because, one, I don't think a lot of us dentists have the proper training. I think being a cosmetic dentist is an art, so you have to have an artistic eye.
Absolutely.
And you have to understand the lips and the chin and the nose and the cheek and the gingival zenith and symmetry, and there's so many components attached to that.
We do a lot of smile design digitally first for
Yeah.
dentists, for patient to look over. We make templates from those scans, from designs. They can wear it. They can get comfortable. If they like it, beautiful. If they might not like a few things, we can adjust before we do the final case. It's a lot of work involved before the actual final case.
And I think the Snap-on Smile, as we're having this discussion, can fit right into that model because, a patient can try it out, trial period, right? They can come back to you in 6 months and say, I'm ready. I'm ready to do this. I couldn't afford $15,000
Right.
or $25,000 or whatever the cost is for my smile, but I've gotten so many compliments over the last 6 months that the best investment I'm going to make for myself is to change my smile.
Absolutely.
So I think that's a powerful thing. So the message here, really, doctors, is that there's, I guess, at some level, I'm not a, as you can tell, I'm not a huge fan of a Sarek in my office, but
Right.
if you do have equipment in your office when you're doing work, please, at times you do need to walk away from, your in-house and refer it to a lab. Let them take care of it for you. I know there are some models where you bring a lab technician in, or you're building out your own lab. I get it. I really think if you're investing in technology at that level, or equipment at that level, you have to be aware of the software upgrades. You have to be aware of the
Absolutely.
maintenance. You have to be aware of team turnover. You have to be aware of the learning curve per se, and you really have to love the lab component of the
You have to trust your
restoration.
lab. You have to
Well,
trust
you
your
also
lab.
have to trust yourself, Gary, because if
Right.
you don't, if you're doing it just to save money, your
Right.
cases are not going to look nice. You really
Absolutely. I
have to be
agree.
a lab technician at heart that really enjoys sitting down and staining and glazing, instead of going, "Hey, I'm saving $20 on this.
Right.
I got to do this,"
Absolutely. I agree.
So if those are not understood, then just trying to save money on the front end, I think, is a mistake to get involved with those kinds of things. Um, Gary, so tell me what's on the horizon for your lab. I know you guys are still trying many different things, and obviously you and I have communicated here in the last few weeks, and we have some ideas and goals that we'd like to move forward on. What's on the horizon for you?
So my lab, people that I work with, I think we have a right now very, very skilled, very good people, highly trained, uh, talented people, and which I'm very happy. Our business very steady, even though the pandemic and everything closures, we were closed for 3, 4 months, 2 months, 3 months, 4 months. It was difficult, not easy to come back to an empty space, but we back fully operational. Everybody's back to work. We back to normal as far as workflow, and we work with a lot of dentists, getting them into a digital, world. They're very thankful that we're trying to help. So the new technologies, new software, we always constantly upgrade our milling machines. We just got something very nice, very accurate Dentron machine from Germany. We spend a lot of money. It's about $200,000 machine. It's mills beautiful, metal abutments, hybrids, anything we possibly can mill. And I'm happy we're growing. I'm happy I met you. We
Yeah.
had a great conversation, and I'm happy to meet people and get it going. It's
Yeah, I think the networking is a very important component of
yes,
this. As I've done this now, and I've talked to many doctors and many business owners over the past 3, 4 years, it's amazing what a small community it is. It's amazing how you network and you meet different people on different
yes,
occasions at the most unusual of circumstances many times. And you build a bond, you build a relationship, and those relationships are where the true value is
absolutely,
in growth. So as a business owner, one of the things you need to pay attention to is access, networking. These are things that don't have anything to do with clinical dentistry, but you need to get yourself out there, and you need to connect with people, shake hands, talk to people. Zoom technology, look what it
right,
can do. You don't have to be on a plane, miss family, miss work, all those
absolutely.
things. Take advantage of those opportunities. And Gary, I know you're opening up some dental practices, so tell me a little bit about your vision there.
Yes, so I have a few very high skilled doctors. They are very good people, very talented people, and I work with them for quite a few years. And I help as much as I can to get them started, to work with them, to get technology in, try to train people in a dental laboratory side so they understand how the prep should look, how the impression should look, accurate impression, quality impression, designing. We train people from a dental side how to maybe do temporaries. So we try to make the best restoration for a patient when they walk out. So they're very happy when they walk out, and they really recommendation is the best thing that you can possibly ask for. So I'm happy to work with my doctors and get those offices running in the best possible way.
Yeah, it's interesting because I think, if you're able to be efficient and you're
Right.
able to manage your time, you can get a lot done in a period of 24 hours, right?
Yes,
Uh,
I sleep maybe 5 hours a day, so
yeah,
which is fine.
yeah, welcome to my world, right? But I think the inefficiencies and going on Facebook and talking to friends about nothing and negative energy and those are
Think
things that,
positive.
yeah, those are things that take up a lot of your time.
Right.
And in the end, you realize you end up in no man's land and you're not really progressing. So surround yourself with good, strong people. Make sure
Absolutely.
you take away negative energy, bring in positive energy into your life. I talked with Dr. Elizabeth Lombardo. She's going to be coming on here in a little bit. And she talks about this person that's always on your shoulder. And it's
Right.
that inner critic that always you're talking to them, right? And that
Right.
person is you, really, right? And you're
Right.
talking to yourself. And many times this person just, you're lying to yourself to bring comfort to yourself.
Right.
So, I think that's important, but,
Positive
really,
thinking is the best thing that you can, do. That's
yeah.
really
And I think a lot of CEOs and business owners, Gary, have that skill. I think this is what sets apart business owners and people that can change the economy. And small businesses are a big part of the U.S. economy. So if you're able to always be positive and look, it's not easy. There's frustrating moments.
there is times that is really difficult, really times that you can go, and think, what am I doing? But you have to get up and do your best.
I've
It's
had I've had moments where I've had money. I've had moments where I've had no money, and somewhere in between that. But you have to push, and I think that's the key
that's it.
component. Gary, listen, I'm excited to be working with you moving forward. You want to tell us a little bit about your lab? How can someone contact your lab? And
Yes. First of all, I want to thank you for bringing me on this, wonderful thing. And yes, so you can reach us at phone number 718-375-5999. You can reach us online at elegantlab.com. We were very happy to help or speak or in any way get in touch with any of you guys, and very happy to be being here.
well, thanks, Gary. We are interested in talking more. I know we're going to talk more after this conversation today. But there's nothing wrong if you're looking for a lab to send a case to Gary's lab and try them out. I mean, you got nothing to lose, and I think it's important to make sure
We'll
that you
do
have that quality.
good by everybody. I thank you guys and I appreciate being here.
Thanks, Gary. I'll be in touch with you soon, buddy. Okay.
Bye bye. Thank
All
you,
right.
everybody.
Take care.
Bye bye. Bye bye.